Greetings in the first lesson. I hope you've watched the video instructions and followed the rules. So let's get started. Lie on your backs, and it's very important to feel our body before each movement. This is a skill that needs to be developed because the more change we notice, the faster the nervous system restructures and the faster we get a positive result. We need to feel our heels, through the heels the position of the feet, feel the pressure of the right and left heels on the floor. If there are any differences between them, don't change anything, just observe. Feel the cavea, popliteal space, hips, buttocks. Feel the pelvic bones through your buttocks. We have a side part, it's iliac bones. The lower part is a sacrum, and we have a zone of alone symphysis, a frontal bone, and sciatic bumps. To feel a pelvic is really important to us. Now we feel the waist, the distance to the floor on the right and left side, the chest, the contact of your ribs. Do you have a feeling of your own shoulder blades? How they come into contact with the floor and ribs? The feeling of the shoulders, the distance from the floor to shoulder on the right and left side. Feel your hands and their length, where your wrists are turned. Feel the neckline and feel the weight of your head through the contact of the back of your head. How evenly distributed is the weight of your head over the back of the head? If you feel that your chin is raised up and it's above the forehead line, be sure to put something under your head so that the back group of your neck muscles aren't overextended. So now we're going to bend our knees, and we need to develop the right habit of flexing our knees. Usually people bend their legs in their knees because they bend in the lower back and start pulling up their legs. It injures our lower back. So we put it on the sole of the right foot, so the leg is already bent. Simple, slowly turn the left foot a little bit and return it to its starting position. Here is a position for a comfortable lifting or flexion of the legs without including your waist. That's exactly how we straighten it up. We slowly lower the knee a little bit and straighten it. The same we do on the other leg. I advised you to learn this movement to protect yourself from back injuries. So now we bend our legs in our knees. We have a certain position. We are looking for ischial tuberosities, on which we sit and put our feet parallel under the ischial tuberosities. Our task in today's lesson is to make sure that we control the pelvic zone regarding to the chest. So we need to find the front iliac bones on the pelvis. These are sticking out bones. If you put your hands on it, you'll feel them. So the first move we'll try to make, we're going to bend in the lower back and roll the pelvis toward the coccyx. If your back hurts or you have any problems with it, remember about the comfort zone. You don't have to do it in a large amplitude. Do it slowly to the count of 5. But the condition is that the chest doesn't participate in it. Put your hands on the ilium, the elbows align on the floor, slowly start moving. 1, 2, 3, looking on your knees, 4, 5. Fix yourself in this position, feel the tension along the lower back muscles. Remove tension from the shoulders and chest, which shouldn't be in this place. Remove tension from your feet, from the inguinal lines, from the knees. Stop and start moving backwards. 1, just relax. 2, 3, 4, 5. Very well. Make sure you don't do it at the expense of your chest. We need to move in the lumbar area of the spine. What does it mean? So we put the thumbs on the rib arches, the rest of the fingers on the iliac bones. This means that the pelvis will move away from the chest and not vice versa, the chest from the pelvis. One more time and look at your knees so that our head makes a movement to lengthen the back group of your neck muscles on the count of 5. So we're going to do it now by 5. 1, 2, 3, 4, 5. fix it. Remove the tension and back. 1, 2, 3, 4, 5. And in the next movement, let's make sure that the line of movement of your pelvis is not a zigzag, but exactly in the same plane. It is very important. 1, 2, 3, 4, 5. And slowly let it go. 1, 2, 3, 4, 5. And now again do the opposite movement. We will contract the abdominal muscles and direct the pubic bone towards the chest. Meanwhile, the chest does not turn on and the pelvis will move towards the lower back. Begin. 1, 2, 3. Look at the eyebrows, relax your neck and release the tension. Return. Now. 1, 2, 3, 4, 5. One more time. Make sure that the chest is not connected to this movement. Other muscles are not strained and the pelvis doesn't move towards the chest. Once again, don't push your feet in the floor. It is really important. So, 1. Look at the eyebrows. 2, 3. The tummy does not rise up. 4, 5. Fix it and release. 1, 2, 3, 4, 5. Very well. Now imagine that you don't have hands. You don't have hands as your helpers. You need to trust your own feelings. Bend at the waist, looking off to the side of the lap. So 1, 2, 3, 4, 5. Relax. Back up. 1, 2, 3, 4, 5. Reduce the abdominal muscles. Move the pelvis towards the lower back. 1, 2, 3, 4. The chest is soft. No tension and release. 1, 2, 3, 4, 5. Straighten your legs and compare our feelings. What has changed in contact with heels, calves, popliteal space, thighs, buttocks? Lower back, chest, shoulder blades, shoulders, neck, and head. Bend your leg at the knee, turn on your side without lifting your head up, push yourself with your hand and sit down. So, this is the first basic movement. With it, the recovery of the lower back begins. You should feel that you control the abdominal muscles, the extensor muscles of the back, and do not connect anything else. And your head moves with your pelvis. If your head doesn't move, it means you're habitually straining your neck muscles. On the one hand, it is a very simple exercise. On the other hand, it's quite complex, especially if there are a few sensations. If you succeed in this exercise, try it for 10 counts, and then you will feel more sensations. I'll be waiting for you on the second lesson.